Hi, this is a live treatment session between myself and Harvins Lyle. So Harvins, what did you come in to see me with?
Coming here as a combination is a very badly pain.
Okay.
Yeah, just improvement now. It's a 90% better. It's third.
So this is the third session today. After 2 sessions, you found 90% improvement within your knee pain.
Yeah.
So what are we going to do with the knee? Well, the diagnosis I gave Harvins was it was a sprain within the medial collateral ligament. That's a ligament to the inside of the knee, and a bit of a sprained tendon. And with a little bit of careful exercise advice and some ultrasound treatment, we've been able to reduce the pain really effectively. And this video is about showing you what treatment would involve. So I've already assessed Harvins jowl, so we're going to just mark out some of the ligaments and tendons that we're going to ultrasound. So let me know. Do you feel the pain into that? Okay. Now, the medial collateral ligament is a rather broad, long ligament, so we've got to mark it out rather carefully. And now we're going to move on to the patella tendon. Now we come to what's called the inferior pole of the patella, down into what would be called the tibial tuberosity, or the knobbly bit on the shin bone. And we can feel there. Can you feel a little bit of discomfort into that?
Yes.
These are very typical areas that these ligaments and these tendons do get irritated, and these are the areas that respond really effectively to treatment. Now, you've been actually you responded rather well to just ultrasound. Sometimes I would ultrasound and acupuncture you. Other times we would get involved hands-on treatment, but you've actually been very, very good. So we've been able to just, all we've needed with you is actually just the ultrasound. Now the settings of the ultrasound are rather important, so this one requires a little bit of my brain power. You'll have to excuse me for a second. Now, because you're getting better, what we're going to do is we're going to up the intensity of the ultrasound. But did you react to the ultrasound at all in the last session? Were you a bit sore for 1 or 2 days?
No.
Good. So what we're going to do is we're going to increase the dose of the ultrasound. We're going to make it a bit more stronger for you. Right. So, we're just going to get the contact gel. And because we've already marked it out, it makes it nice and easy for me. Perfect, just into there. Okay. Now again, at some point you might feel a little bit of discomfort. If you do let me know. Treatment will provoke the tendon, and that will cause some pain, but I like to regulate that very carefully. Feeling now? Good, okay. And now what we'll do is we'll just move out of there, and we'll move back in. Okay, you're doing well. If it gets too much, do let me know. Have you been doing more activity? You said you've been doing more activity this week. So you've been standing for 5-hour sessions at work? What else have you been doing in terms of more activity?
Nothing, just standing out quite well. No problem now.
Is that generally more standing than you would do?
Yeah.
In one way, I think your knee is showing you might have overdone it slightly, because compared to the way you reacted with the ultrasound last week and the way you're reacting this week, it just says that your tissues have slightly become a little bit more damaged. So
because are quite feeling better.
Yes, so you did more.
Yeah.
All you have to take away from that is to know you will still carry on getting better, but to not to do too much activity too soon. Still carry on building your activity, but take your time with it. Now, similarly, we're going to do the medial ligament. Perfect. Now again, this part, if the camera can show you, this part of the inside of the ligament you'll feel pain. But do let me know when you feel that, and then we'll move away from it. So did your daughter tell you how she came to know of me? Yeah.
Yeah. Her friend is a sweetheart, you know.
Yeah.
She come in here. Then she told me when I'm in India before. So she said, I don't make an appointment. I said, don't worry, when I come back, then you make me. When I come here, I was so badly, you know, I can't move in my leg, you know. Just now, perfect.
Perfect. I'll shake your hands.
That would my hand.
All I will say is from this point, do you know the hot and cold pack advice I gave you? Carry on using that. Even though you're better, you want to use that at least for the next couple of weeks, because your, shall we say, the tissue rate, the turnover of good tissue is going to carry on, but you need to kind of promote that with the hot and cold therapy.
I do 2 or 3 times a day, you know, in the morning.
Good. That's exactly the way. And basically, this is what treatment would be. Thank you very much for watching.
Thank you.